the most important thing you can do is actually listen to what the patient has to say. And also turn off your ego. I also experienced what it's like to be treated badly by a physician. The physician I was visiting was very arrogant. He refused to take a look at 2 pathological examination results and a written professional opinion by a professor. He refused to see all that, and he would stick to his own initial idea that everything is fine, when actually it wasn't. And the more he realized that he was wrong, the more arrogant he became, and the more he tried to evade the situation. The confrontation with the fact that I am wrong or you're wrong was the hardest thing to do. Subconsciously, he was avoiding to confront the fact that he was wrong. That's why it's most important to listen to the patient and not be egoistic or egocentric. Just listen to the patient and what he has to say. So osteoporotic patients usually report something that's really indicative for the diagnosis. And they report either that they're taking medication that can lead to or accelerate osteoporosis, or they had slight trauma that resulted in fractures when nobody saw it coming. So what osteoporotic patients have to say is really important. That's what can lead you to a direct diagnosis right at the beginning. For example, they might tell you that they're taking medication that's accelerating osteoporosis, if not causing it. Also, they might say that they had a trauma or injury that led to a fracture when injury was really something simple, something that nobody would assume can lead to a fracture. So what osteoporotic patients have to say can easily lead us to a diagnosis. And what they might say is, for example, that they're taking medication that's accelerating, if not causing, the osteoporosis. Also, they might have had a slight injury that resulted in a fracture. Nobody would assume that that kind of injury could result in a fracture. The next step in diagnosing osteoporosis is the clinical examination. Clinical examination includes measuring height and weight of the patient, testing pain points on the body, and also looking for loss of function in certain joints. After we have the symptoms and the clinical examination that indicate osteoporosis, we can actually do the test that's going to test the bone mineral density. And this test is called bone mineral density test, or the Dexa test. Here, the results are given in the t-value. And if the t-value is minus 2.5 standard deviation under the average of what we would expect to see in a 30-year-old healthy individual, then we have the osteoporosis diagnosed. If the patient is too old, has many other diseases, and has specific fractures for osteoporosis, then we don't have to do the Dexa test. These fractures would be the fractures of the femoral neck and also fractures of the vertebral bodies. These fractures are usually caused by compression, and this is logical, isn't it? Because osteoporotic patients have less bone density. Their bones are simply weaker and more prone to fractures. These points are the ones that are transmitting the weight of the body to the ground. So the weight goes through the vertebral column, then over the femoral neck down to the ground. And that's where these fractures can happen. In lab tests, we're looking at the calcium and phosphate values and also thyroid stimulating hormone, because hormonal imbalances can accelerate or even cause osteoporosis. But let's talk about therapy when it's not just caused by hormonal imbalances. Let's talk about general therapy for osteoporosis. So first things first, we go for pain management, that is painkillers, and we're also looking at mobilizing the patient and starting the rehabilitation program. If, however, the t-value is below -1, or if they were fractures, or if the patient is taking therapy with glucocorticoids, then we're looking at the base therapy and specific therapy with medication. And these are regulated by World Health Organization guidelines how exactly these two will look like in each specific case. What if the patient has no pain? What if there are no fractures and no therapy with glucocorticoids? What is the therapy in such case? Well, we just continue with prophylactic measures against the osteoporosis and the fractures. That includes a variety of things. You want to change what you eat, what you do. So you want to have healthier diet, lose weight, have adequate supply of vitamin D, and also physical training and strengthening your muscles. And the last thing that one can always do and always benefit from, always, is actually to stop smoking, because smoking also accelerates osteoporosis. Smoking, believe it or not, has been identified as a risk factor for osteoporosis as well. And it's a risk factor for so many other things. Heart disease, lung cancer, and whatnot. So you can always benefit if you stop smoking. If you need more help and information about symptoms, then go to Symptomsky.com. There you can find experts and our software for symptoms. If you are studying or teaching medicine, then go to Anatomsky.com. There you can find these animations and 3D models in software I made.